Now let's talk about HIPAA and core measures. HIPAA is something that many of you are probably very familiar with, either professionally or just personally. And core measures is probably a newer concept to many of you. So a few questions to start, just things to listen out for throughout the lecture. What is HIPAA? First of all, notice it is not spelled with two P's, which is often on social media how you see people spell it. It's generally an indication to me that they don't really know the true definition of HIPAA and what it entails. So after you learn about this, this is how I expect to see you using this acronym with one P and two A's. What does the acronym stand for and why is it important? What are core measures and some examples of core measures? HIPAA stands for the Health Insurance Portability and Accountability Act of 1996. A few things to note about HIPAA. It's commonly also referred to as the privacy rule. In the law, covered entities refers to anyone with access to the individual's health records or any institution with the individual's health records. So this is things like clinics, hospitals, etc. PHI is the acronym for Protected Health Information. So examples of protected health information are PPI, a lot of people will call it protected personal information, things like social security numbers, credit cards, driver's license numbers, clinical information, individually identifiable health information, names, dates, telephone numbers, geographic data, email addresses, medical record numbers, account numbers, health plan beneficiary numbers, device identifiers, serial numbers, full face photos, biometric identifiers, any unique identifying number or code, birth dates. So you think about any time that you fill out paperwork at a doctor's office or at a hospital, you're giving them a lot of personal information that if exposed, 1, 2, 3, 4 pieces of information, somebody could find out a lot of things about you. Somebody could apply for a credit card in your name. Somebody could find out where you live. So that's why it's important that we're holding all of this information close to us in a medical setting to protect the privacy of the individuals we're caring for. So just a general overview of this privacy rule. So patients are in control over their information and they choose how and who can use it. Again, this applies to covered entities. So this applies to hospitals, clinics, urgent cares, etc. Minimum use is the concept that we develop and we take on, meaning that the person with access to the individual's health record should only access the minimum amount of information necessary to complete the task at hand. If I am the phlebotomist and I'm drawing blood on the patient, all I need to know are what labs are ordered. I don't need to go through the patient's chart and see what their sexual history was. Are they married? That's not minimum use. I just need to know what I need to know for my position. These standards are consistent nationally. So from facility to facility, they should be adhering to these standards. And I think probably several of us have signed, I've received the privacy practice notice or notice of privacy practices from this clinic, reviewed it, and I agree when we're signing in at any clinic. Limited use of personal health information, which leads to limited opportunities for inappropriate disclosure. So this kind of goes back to minimum use. If I'm only accessing what I need to access, I'm only using it in whatever way, helps me do my job, I'm only discussing it with pertinent people, I'm decreasing the risk that I'm going to have an inappropriate disclosure of this information. And violators of the rules are held legally accountable with civil or criminal penalties. So we went over several kinds of PHI on the previous slide. And under these rules, who do you think might have access to PHI? So obviously the patient has access to their own PHI. They know their own PHI. And then anybody that's directly involved in that patient's care. So you have a family member in the hospital and you work in that hospital, if you're not directly involved in their care, you should not be in their chart. You hear that the celebrity came in through the emergency department, you have EHR access, you're curious, you shouldn't be accessing their chart if you are not involved directly in their care. So just people that are involved directly in the patient's care. Let's do some practice HIPAA questions here. So while working in the ER, you notice your neighbor's name on the board and see that she is there for chest pain. She is a close friend with your mom, and you know that your mom would want to know that her friend is in the hospital. What should you do? A, when you get home from your shift, call your mom to tell her that you saw her friend. They are friends, so the woman will probably want your mom to know she was there. B, keep the information to yourself. If this woman wants her friends to know she's in the emergency department, she can tell them herself. Otherwise, it is a violation of her privacy to disclose this information. C, wait a few weeks and then mention the event to your mom. Since the woman is already out of the hospital, it doesn't matter if you share this information. So think about this one for a few seconds, and the answer will be on the next slide. The answer is B. So keep the information to yourself. If this woman chooses to let her friends know that she was in the emergency department, she can tell them herself. If you go out of your way, especially even if you were involved in her care, it would be inappropriate for you to tell other people because it violates her privacy. You have to treat every person, every patient with the same respect and privacy, and it doesn't matter if you think this information about them is common knowledge. So a trauma case comes into the emergency department and a resident sees the patient. You overhear that the patient has some very severe injuries, but not what they are. Should you A, look at the results of the radiology? Everyone is talking about the patient anyway. It's basically public information. B, look at the x-ray results that the resident left up on the screen. It's not like you're accessing the information on your own. C, leave the chart alone. This is not a patient you are seeing, therefore it is outside your job responsibility. Again, take a few seconds to think on this one. So the answer here is C. Leave the chart alone. This is not a patient you're involved with. You are not involved in their care. Therefore, it is outside of your job responsibility or business, honestly. So A is incorrect because this is not public information. B is incorrect because the resident should have not left these results on the screen. It is a HIPAA violation for him or her to do so. And I want you to think about when you see other people perhaps unknowingly putting patient privacy at risk, how you might approach that situation to correct it respectfully. There's always a way to speak to somebody that is going to put you at better chances of not upsetting them. You could be like, excuse me, Dr. So-and-so, I noticed that the chart was still up in that room. I saw it walking by. Did you forget to close it? Are you going back into that room? Should I shut the door to protect the patient's privacy? Some people will still get bent out of shape, but in the end, your goal is to make sure that the patient is protected. Your grandmother was admitted to the hospital yesterday, and you haven't heard any updates on her status yet. What should you do? A, since you have access to the hospital's medical records, you open your grandmother's chart. She's your family, so you're not violating privacy. B, you wait until your break and call a family member to see if there are any updates. Looking at her records is outside of your job and therefore should not be opened. C, I can look at her labs as long as I don't open the note. And here the answer is B. This might be very tempting to do, but you may not access any chart that is not a part of your job, and this includes your family members. Labs are also considered part of personal health information and should not be opened by you when you're not directly involved in the patient's care. So this video here, I won't play it in this presentation. You can double click on it in your own time. will show, I want you to look for the HIPAA violations. I want you to watch these patient encounters. I want you to watch these staff encounters and see if you can't find the HIPAA violations. So HIPAA violations can lead to termination of your job. This might be intentional violations or unintentional violations. So it's important to stay very self-aware of the actions you're taking, the things you're doing at work. They can also lead to fines to you and or your institution and potential jail time. The link here, you can read the law verbatim, but conceptually it's pretty simple. Don't access information that you don't need to access. Only discuss information with other people that are part of that patient's care team, and do so in a way that still protects their privacy. So don't discuss in hallways, don't discuss in elevators, don't talk about it online, etc. The Centers for Medicare and Medicaid Services, also known as CMS, core measures. So core measures are national standards of care and treatment processes for common conditions. These processes are proven to reduce complications and lead to better patient outcomes. Core measure compliance shows how often a hospital provides each recommended treatment for certain medical conditions. You can see and go look at core measures at this link here. And I encourage you to explore the site a little bit just to kind of get familiar with what some of the core measures are, etc. So an example would be the Johns Hopkins Hospital. They assessed for the flu vaccine among their patient population. And let's talk about what this measure means for the quality of care. The influenza vaccination is the most effective method for preventing influenza virus infection and its potentially severe complications. This measure is the number of hospitalized inpatients who were screened for seasonal flu vaccine and were vaccinated prior to discharge if necessary. Data was only collected during flu season. So the first part of that standard was simply screening patients. So just asking, have you received the flu vaccine this year? Yes, no. Would you be interested in receiving the flu vaccine while you're here as a patient? Yes, no. If yes, then giving that flu vaccine. That was part of that core measure, pushing for a decrease in influenza cases that year. So what is the point of core measures? So all in all, they're designed with patients, consumers, and physicians in mind. They help with measurements that are evidence-based. So we use the best evidence to create these measurements, these scales, and they allow us to generate information for quality improvement. So if we're all following the same standards and we see that something's not working, we can, start generating those changes so that patients are better taken care of. It helps with consumer decision making. It helps with value-based payment and purchasing. There's a reduction in variability in measure selection, and it decreases providers' collection burden and cost. So these are the stated intentions, and they do all of these things, core measures. The cost of healthcare in the United States, unfortunately, is super variable, and core measures kind of works to decrease some of this variability, streamline costs for these common illnesses. And you can click the link or copy and paste this link and review some core measures. So when talking about core measures, we have to talk about the Joint Commission. So the Joint Commission, or JCAHO, JCAHO, is the accrediting body for hospitals. So they conduct accreditation evaluations every 2 to 3 years to assert that safety and quality standards are being met. Passing the accreditation process is important because it will directly affect Medicare reimbursement, and much of the actual evaluation is based on core measures. So let's tie this back into why it matters to you, the medical scribe. So depending on the care area you work in, there will be a different focus on different core measures. Your thorough and accurate documentation of the care rendered by your physician is imperative all the time, but especially so when the patient's diagnosis relates to a core measure. Ultimately, it is the job of the patient care team to conduct proper patient exams, tests, and/or assessments, but you must be an active participant with your accurate and timely documentation. So if, let's use the flu vaccine example. If you know that's a core measure, you hear your physician ask the patient if they've been vaccinated, you hear the patient, the physician offer the vaccination and the patient say yes or decline, it's important that you're documenting all those things so that core measure is met in the chart. So this slide was obviously made with in-class discussion in mind, but I want you to think about what you learned today. Think about HIPAA and an example of a potential violation. And I want you to reiterate to yourself why core measures would matter to you, the medical scribe. Any questions, comments, or concerns, feel free to reach out to me.